How are your family members this morning?
Good morning, Laura, and good morning to your viewers. I've actually just spoken to them in Howard Springs. I've been able to speak to my sister for the first time since she left Robinson River. Yesterday was a terrible day in terms of just the effects of COVID on her, but today she sounds in much better spirits. Still a long way to go, obviously, but it was really nice to be able to speak to her, Laura.
Yeah, okay, so they're all reasonably well given the circumstances?
Yes, look, I've also spoken to my cousins in there. They obviously have the effects of COVID at the moment, and it's still an anxious time. I don't want to downplay that. I guess from a personal perspective, it was just a relief to be able to speak to my sister in particular. I had spoken to my cousins, I spoke to my auntie and uncle this morning, and people are feeling a little bit better, but obviously conscious that there's still a way to go here.
Yeah, authorities do expect there to be more cases today. Do you know the source of infection, or do your family members suspect where this first came from?
This is the mystery that's confounding the Northern Territory experts in terms of the source of COVID in Katherine itself. I know that my sister was the one who took it into Robinson River. We know that, but we don't know the actual full source here in the Northern Territory, which is why the Chief Minister has called for a mask mandate right across the Northern Territory, because it's quite possible that there has been a seeding of infection to other places, but we don't know that for a fact yet. I guess we're waiting for today's results.
Yeah, indeed. Talk to me about the vaccination rate amongst your family as well, but it is so patchy right across the territory, isn't it?
Look, I travelled across the Northern Territory. I drove. I got in a car, in the last few months down the Western Desert in the Tanami region, from Lajermanu down to Yuendumu, Santa Teresa, and visited communities. There was still concern, obviously, and I've raised this previously, Laura, in the media, just about the misinformation that was coming and still does come across social media. We have to work harder to combat that. Those messages are really destructive, and they do impact, and people do believe and listen to them. So talking to the Aboriginal community health sectors across the Northern Territory, certainly needing the First Nations media organisations to consistently put out the messages that the vaccination is the way to go to lessen this impact.
Has there been a complacency, a view that perhaps, well, erroneously we know that COVID just wouldn't get into these communities?
Look, we have been fortunate over the last 2 years to keep it out as best we can. I think where we've fallen down is that it's been in the communication. I did ask the Federal Health Department in February as part of the First Nations Labor Caucus briefing, what were they doing to put out messages in language. Here in the Northern Territory we have over 100 First Nations languages, and obviously across Australia there are many others. So when I found out that those languages were not translated via the First Nations media until later this year in September, I just felt that there's been this massive void where that negative messaging has kind of filled that void. So I kind of feel like the horse has bolted here and we're playing catch up. And I do think that is something that, people have to take responsibility for.
You were accused by the Chief Minister, I think back in September, of being an anti-vaxxer.
Yes, that was completely wrong and totally unhelpful and a massive distraction, given that I was travelling across the Northern Territory encouraging people to vaccinate. I guess it's just also a sign of the stress that many people are under and the different ways people view things. But I'm certainly not an anti-vaxxer, and that was the wrong message from the Chief Minister.
Has there been, we've talked about the complacency, we've talked about the social media messages. Does this change things, do you think, among these communities? Will this, if there's anything good to come out of it, will this spur people on to get vaccinated?
Look, there's no doubt. I think we've seen even across the country, Laura, that the moment there is a COVID infection, there seems to be a real spike in vaccination, which we have seen, and we've certainly seen here in the Territory as well. But one of the things I've noticed in the last couple of days that worries me a little bit more is once the COVID infection is in, there does seem to also be a fear or an anxiety about identifying where you've been. So I've been trying to encourage not only my families, obviously, who are at the centre of this now, but also to other people, please, work with the contact tracers. Don't be afraid here. We have to be able to understand where you've been, who you've been in contact with, if we're serious about trying to minimise the impact of this disease.
Yeah, indeed. And Ernie Dingo has joined the push to try and encourage people to get vaccinated as well. Has part of the problem been the remoteness of some of these communities, the fact that you might have to travel sometimes for hours to access it? Are the vaccines going to the communities that need it rather than the communities needed to travel?
Look, I understand that the vaccines are out there. In terms of certainly the NT health clinics and the Aboriginal community health organisations. The reality though, Laura, is actually getting the people there. So what the ACCHOs or the Aboriginal community health organisations are doing is door knocking. They're just going to the people. They're holding barbecues, they're doing things to encourage them. Here in Darwin, we had the local Aboriginal health clinic here, Danila Dilba, hold a vaxathon where they had a massive day of barbecues, encouraging kids and their families to come, just to show that it's okay to get vaccinated. Please, just get vaccinated.
Good message. Malarndirri McCarthy, thanks so much for your time.
Thank you, Laura.